So we're going to talk about wound care today. What is a wound? A wound is simply a break in the skin, which can be deep or superficial. So all of us are going to have a wound at some point in time in our life. The question is what to do for it. The good thing is most wounds don't require anything except just keeping them clean, which means you wash your wound regularly with soap or water or with something stronger like betadine. But the most important thing is to know two things. Number one, why is a wound there? And number two, what do we need to do to be able to get it to heal? So the first question about why the wound is there can be from several things. So one of the most common reasons is looking at one's circulation. So there can be a shortage of good blood coming down to the wound, or there could be too much of blood that's not going up and sitting towards the foot that causes swelling in the ankle that can cause the wound not to heal. So this is just one part of a wound. You can have other wounds, such as those after you've had an operation, when the wound has been stitched together but doesn't heal for a variety of reasons. For example, in patients who are receiving chemotherapy and their wounds can separate, or something called dehiscence. The most important thing, as I said, is to find out the cause. Once you've found out the cause, you need to see the depth, the extent of the wound to be able to decide what to do. So once you've identified the wound, once you've cleaned the wound, then it comes down to how do we manage it over the next few days or weeks or months. So there are a host of dressings that are applicable in this. The reason of deciding between one dressing or the other really depends on the nature of the wound itself. So if a wound is too dry, you want to be able to put some moisture retentive dressing that keeps the wound moist but allows it to slowly allow the cells to migrate in so as to cover the wound. On the other hand, you can have a wound that is draining out too much. If the wound is draining out too much, sometimes we'll use a machine like a vac machine, which we will put on the patients, and then they will have this as a purse that they will carry along, and this will be there for a question of weeks or months, and then slowly the wound will heal. So now once you've done the workup of finding out where the wound is, what the level of infection is, and starting the antibiotics, then you want to be able to put a course in place that allows you easy access to a person. So this is the most important thing at this stage, is that you have a person with whom you can communicate, and sometimes the physician is a difficult person to get hold of. So this is why the comprehensive wound care clinic that's set up here allows us to be able to have a point person who is certified in wound care that allows you to have all the other specialties answered to, so that the care is given to you from one person but with the input of everybody else from all the other specialties. So once the wound is healed up, then the question becomes, how do we make sure this doesn't happen again? This again comes back to the whole multidisciplinary team that's set up so as to make sure everybody's input is taken so that once fixed, it stays fixed. And this allows you to get an outcome that is not available anywhere else because of the team available.